How to give an intravenous, for injection in a dog. Administering and for injection ensures rapid drug absorption and immediate effect. Proper technique is crucial to avoid complications. Steps to administer and for injection. Restrain the dog. Hold the dog securely with minimal stress. An assistant may help stabilize the limb. Select the vein. The cephalic vein, forelimb, is most commonly used, but the saphenous or jugular vein may also be option. Clip and disinfect. Shave the area if needed and clean with alcohol or chlorhexidine. Apply pressure. An assistant occludes the vein proximally to make it more visible. Insert the needle. Use a syringe with a needle or a butterfly catheter. Hold at a 25 to 30 degrees angle, bevel up. Advance the needle until blood appears in the hub, flashback. Aspirate to confirm placement. Pull back slightly on the plunger to ensure blood flows into the syringe, confirming the needle is in the vein. Inject the medication. Slowly administer the drug while monitoring for swelling, indicating extravasation. Withdraw the needle. Release the pressure. Remove the needle smoothly, and apply gentle pressure to prevent bleeding. Monitor the dog. Watch for signs of adverse reactions, such as swelling, pain, or systemic effect. Precautions. Use sterile technique to prevent infection. Ensure proper needle placement to avoid perivascular injection. Inject slowly, as some medications can cause irritation or collapse the vein if given too rapidly. How to access a vein in a dog. Accessing a vein in a dog is essential for administering medications, fluids, or collecting blood. The procedure requires proper restraint, site selection, and technique. Steps to access a vein. Restrain the dog. Use minimal but firm restraint to keep the dog calm. An assistant may hold the dog in a standing, sitting, or lateral position. Select the vein. Choose an appropriate vein based on the procedure. Clip and clean the area. Shave the site if necessary, and disinfect with alcohol or chlorhexidine. Apply a tourniquet or pressure. This helps engorge the vein for better visibility. Insert the needle or catheter. Hold the syringe or catheter at a 25 to 30 degrees angle. Insert it. Bevel up, and confirm blood return before injection or collection. Secure the catheter. If used, tape the catheter in place if continuous access is needed. Common venous access sites in dogs. Cephalic vein located on the forelimb, commonly used for injections and catheter placement. Saphenous vein, lateral saphenous, outer hind limb, preferred for quick blood draws but prone to rolling. Medial saphenous, femoral, found on the inner thigh, useful in smaller or fractious dogs. Jugular vein found on either side of the neck, ideal for large blood draws and central venous access. Auricular vein located on the ear, used in small or critical patients when other veins are inaccessible. Choosing the right vein depends on the dog's size, temperament, and medical condition.